I'm Dr. Jag, a GP based in Adelaide, and I recently attended the NLP Practitioner training with Sherry Farrow, along with my wife Supriya. So to be very honest, as a medical doctor, I came into it quite skeptical, but what I experienced was beyond what I expected. It was transformation. We learned powerful techniques like transformative language, timeline therapy, and tools that help you get to the core of what people are really feeling and needing. What really stuck me was that I didn't just learn the tools, I used them on myself during the training and experienced deep healing. I felt lighter, clearer, and genuinely empowered. Now, as someone who has just launched a new clinic, I can already see how these tools are helping me and will continue to help me better connect with my patients, understand what they truly need, and guide them towards self-healing. These aren't just theoretical ideas, they work, and they work quickly. Regarding the accommodation, it was absolutely stunning, right by the sea. The peaceful setting was just right for us to reflect, recharge, and bond with others. We also made many new friends, and the group transformation over just 1 week was incredible. What I also appreciate is how Cherry and the team ensure this learning stays with you through review sessions, through their masterclass, and continued support. I'm grateful to have done this training, and I'd recommend it to any healthcare professional and anyone else who wants to deepen their understanding how to listen, how to speak, and how to support healing at a whole new level.
My name is Supriya and I'm a high school teacher. I work at Adelaide. I attended NLP Practitioner training and I was the one who really wanted to be involved in NLP, and it was honestly one of the most life-changing experience that we have had together. As a teacher, I always look many ways to connect more deeply with students and parents. And also, I always reflect on how I treat my partner, husband, and that helped. These techniques that we have learned, such as presupposition, helped me understand that Dr. Jag wants to hear soft tone of language, communicate in a way that we understand other person's map of world. I do love the goal setting technique out of all. That's one of my favorite. I also loved timeline therapy. That's my, I think, second favorite. The training was just not informative. It was actually a healing session. The way it was structured, it helped to see us, the world, in a different lens. And we saw real transformation around us, and including myself. I can feel it. When I walked out of after the 7-day training, walked out of the last session, I really didn't want it to leave. I thought I could get more. So it wasn't enough. The environment was beautiful. As Dr. Zach mentioned, the accommodation was just perfect so that people realize, rejuvenate, in a peaceful setting. We connected with so many like-minded people, and it was a strong sense of community and, the support that we got. And we're still getting support. One phone call away, which is a very true statement when it comes to Cherry Farrow's, sessions, and even the entire team, including you, Dot. What I loved most is that it wasn't just a one-off event, as I said. And Cherry and her team has continued to embed the learning through the follow-up talks, the reviews, the masterclasses, and so many tools that we have been given to practice as a part of our everyday life. And a constant reminder that we can do it. Excited to take these skills in both my personal and professional life and help others grow. I feel that people should feel heard, because I want to be heard, and I feel empowered, but I also want people to be feeling empowered.
Thank you so very much. That was absolutely perfect, both of you. Thank you so much. So the first question is, what was your pain point that motivated you to look at this training for the resolution of that pain point, would you say?
I was always interested in hypnotherapy when I came to Australia. In England, I did my training. Over here, I spoke to many patients who were trying to give up and they had used hypnotherapy as a pathway. And as a GP, there is an item number to do hypnotherapy training for smoking cessation in a group therapy session. And I wanted to learn about it, that how is it that someone can come out of a session and not smoke, because there is a physical dependence of nicotine. And as a GP, I'm always prescribing nicotine replacement treatments. So how is it that the body becomes so powerful that after a session? And I was intrigued as to what they are talking about. And I attended the first hypnotherapy training in Adelaide. It was convenient. I had been thinking about it for a few years, but because it was a few days of training, it was in Adelaide. It just landed in. I spoke to Supriya and she was like, "Yeah, let's learn more about this." In the session, I met many others who had done NLP, and that was the first time, Sherry had, even including Di, when I talked to you, I got to know about the concept of it. And I always felt that I need to improve my communication. I need to be able to understand what the other person is saying and not just always tell about the condition or the medical diagnosis, but to understand what is affecting them at a person level. So when you talked about NLP being healing and transformative, not just for the patient, but for myself, I got intrigued, and my partner's support, like Supriya's support, was paramount, because when I discussed this with her, that we need 7 days off in a crucial time when we were building the clinic, that's when she said, like, this will really help you. So the pain point was to learn more, and it was more an intriguing subject for me. And when you added on that you have a beachside place and there'll be community supports, and there'll be others around us, it'll be a fun time as well. So that.
Wonderful. Do you have anything to add, Supriya?
Yeah, pretty much Jack has covered everything. For me, the pain point was actually the life experiences that I have had individually, and what we have had, been to in situation together. And I was exploring Hypnosis, and I have done guided meditations and meditation classes done by Deepak Chopra's assistant, and I've learned. And then I just wasn't consistent enough, and I wanted to get motivated again. And obviously the NLP techniques were quite different, but aligned with what I knew. I had no clue about Hypnosis, what Hypnosis can do clinically, because I'm not from clinical background, but I've seen students struggling, in day-to-day basis. And we all have our days. We forget what other person might be suffering or starting the day with, and what they might be facing issues with. And if you're just mindful, it kind of creates a lot of that bridging gap that's there between you and other person, and you try and see with a different lens. So I knew that, but then having those techniques helped a lot. So that was my pain point. Was
What made you choose Successful Minds Institute?
When I first got onto hypnotherapy training, I had a look at Sherry Farrow's videos, and she was a local almost, and I was listening to what she was not just doing stage hypnosis, but she was trying to heal people through hypnotherapy, and she was trying to explain what it does. That got me interested in that. Going on to the first hypnotherapy training, looking at the community, looking at the trainers, talking to the trainers who were so passionate, and others who've had NLP training, all this kind of anchored that part, that I am in the right place, and Successful Minds has the right intentions, and they have a greater vision of having many people understand and learn this technique and become many healers for themselves and have and for others. So, and you guys have proven it.
What was your biggest concern or fear before doing the training, would you say?
I would say up until, because I didn't do hypnotherapy at all. So it was pretty much a brand new space, environment, and people. Jai, on the other hand, knew a few people and knew what he's putting himself into. For me, it was just my own understanding, right? So the biggest fear was for me that I wasn't able to listen to all the videos, and because of the busy schedule of job and a clinic and house. And I was like, I'm going with pretty much bare minimum knowledge, so not prepared. I don't know how I'm going to learn and how I'm going to do the test. And so that was my fear. And also not knowing what I'm getting into, just that basic understanding, because of the fact that I couldn't read and I couldn't, do the free reading at a level that I should have or I could have. But then, you know what? Once you're in, I guess everyone says once you're in the water, you learn how to swim. So once I was in, I just made sure I was up most of the nights. I was reading, I was making sure that I was going through things, and I had my own shortcuts to learn things that I tried my best to understand. And while I was there and during the day when we had training sessions, I was entirely focused. So that helped me. And the practical sessions helped me as well. So I think at the end of the day, fear was gone. No fear in terms of NLP language. So I wouldn't say there was any fear anymore.
Wonderful. So it didn't come true, that fear. And what happened instead?
Well, I think I walked out with more confidence and empowerment. That I was already a confident person, but I think I walked out with sort of more trust and strategies and skills to cope up with a situation sometimes that we don't know how to cope up with.
Wonderful. What about you, Jang? What was your biggest concern or fear before doing the training?
One of the concerns was that, look, how will I amalgamate this into my day-to-day allopathic medicine, because I'm practicing as a GP and a skin cancer doctor. I did talk to Di about this, and you tried to explain to me that how NLP and transformative languages can help heal the patient. But my fear was, if I do this, how will I be looked by my fellow colleagues, and what is he trying to do, learn, and how will I advertise this? But I've understood that I do have a lot of work to do with myself. And when I've spoken to patients now who have had long-standing scars and acne and skin conditions, they have been quite open to accepting this. So I will probably try and do a self-guided meditation plan, in which can be easily accepted and amalgamated in my healing with lasers or whatever the treatments I'm doing.
Wonderful. And so did it come true, or what happened instead?
Said is definitely now I know I can amalgamate it in a very gentle manner, but I have a hope that once I understand this more, once I've practiced it more, I can then bring a generic version out for other practitioners who can then start working with their clients on this. And like even it will be a gentle introduction for people who just want some sort of hope that they have been carrying this baggage of skin concerns, how they can at least not dissociate themselves from that and tell them that you're more than this. So I'm quite hopeful of trying to make a generic version of healing, self-healing for that Ricardia.
Wonderful. And what would you say, you touched on it, Supriya, but what specifically would you say was your favourite part of the training?
I obviously, as a teacher, I always think practical sessions. Theoretical knowledge is equally important, but practical experience that is coupled with theoretical knowledge always gives you a successful outcome. So the fact that it was done in such a beautiful way that theoretical part was there, but also we got to implement that practically. The practical sessions they were my favorite. And also you had the team, coming and supporting at every point when we were becoming practitioners or clients. That was my favorite part. And some Dr. Jack's coffee that everyone loved it. Definitely that part was favorite.
And what about you, Jag? What was your favourite part, would you say? If you had to pick something, what would you pick?
Yeah, but my favorite parts was definitely the practical sessions.
Yeah.
Practical sessions, and when I was intrigued seeing transformation in people and real transformation happening. There was a friend of ours who was struggling with dyslexia for her whole of her life, and just with one session, she was able to read.
Yeah.
And there was someone who was struggling, with pronunciation of certain words. It was just spelling and pronunciation, and it's very transformative to see that. That gave me hope that great things can be done with a better understanding of NLP, and more people should learn this technique.
If you were to recommend this training, what would you say?
Well, I would say if you want to go to holiday, people go to holidays and pay for meditative sessions and, learn those skills. I think I would say that if you want to learn about yourself and heal yourself from inside out, this is the training session that you should go for.
Yes, I would agree that this is a very good way of putting it.
Thank you very much. And if you could summarize your experience in a few short sentences, what would you say?
Peaceful, abundance, because I got happiness and abundance, inner strength.
Transformation.
Yeah, transformation is the word for you. That's right.
Hopeful.
Yep.
And this was actually one of the... Are we doing therapy here? Because that's what we came up as well. This is one of the training sessions. We had to come up with the words that pop out this. You're not trying to do it. You have fun. You will have fun. You will learn. These are practical tips. And NLP is fascinating. That how language... That's a part of it, how language can have profound impacts on yourself and on others.